Hello guys, I'm Dr. Rose. Today I'm going to be discuss with you FSRH 2016 COC and VTE. So, backline skin page and the combined vaginal rings. So here we have the risk of the VTE that is rare, but and the remaining it is important themselves to be the vigilant about the sign and the cautious patient with the remaining the vigilant about sign and the symptoms. So we have to be look the patient if going to be suffer any VTE risk factor, we have to be look and manage according to the management of the contraception. um, so the remaining the concluded that there was the good evidence to be suggested that the risk of the VT associated different COCs and influencing by the progesterone type with those containing like 5 levogestrol, norethinesterone, and noregestrotime having a lowest risk, that will be the 5 to 7%, and this is per 10,000. This is important at the question point of view. And those is containing like disoesperenone and disogestrodiol and gesto, then having a highest risk. This will be the 9 per 10,000 women, 9 to 12 9 to 12 per 10,000. So incidence of the VT, if we look, this is the 1.5 to 2 times higher the user with a cripnodiol that the user of levogestrol containing COCs, and they have been the similar risk of the associated with the disogestrol, gestodin, and the desperenone containing COCs. So VTE risk will be the higher first. The 4 month having to the initiate like a combined hormonal contraception containing the restarting after the break at least 1 month. This will be the we have to be initiate COC, and when we restart after the break of the 1 month. So going to be the risk with the 4 month follow initiate continuous. So we have to be break up of the continuation. Risk of reducing over the next year and remaining unstable therefore. So we have to be take care about this. Although the risk is going to be higher in the first few months of a combined hormonal contraception, and then the fall, it remaining is higher than the non-users. So here we have the recommendation by Mahira issue. Updated advised by the health profession in the UK by benefit of a cripnodiol or outweighed that risk of the woman with the reproductive age of the treatment of the skin condition related androgen sensitivity. For example, patient with a suffering with the acne or without seborrhea or androgen sensitivity. So here the management of co-cripnodiol is going to be the outweighed risk of the reproductive age, the treatment of the skin related androgen. Okay, so here first we will to be say what is thrombosis, why we are worried about this thrombosis. So venous thrombosis, it is a clot in the vein, most often diagnosed in the leg, whether the maybe with the patient will complain the pain, swelling, discoloration, clot become is dislodged, and can be the travel emboli through to the bloodstream to the lung. This result the pulmonary embolism will be happen, and the blockage of the blood vessel that going to be supply the lung, which can be caused chest pain, breathlessness, and sometimes the cough with the blood. So this event collectively the term of a venous thromboembolism, that is a very occasionally, and the clot occur in the large venous that carry the blood away from the brain, and the extremely rare event. This is a very extremely rare event. The term we will say the sinus thrombosis. The patient will represent with you the headache. So we have to be take care about this whole scenario. If the woman with the having the VT event, even this is a rare woman with a reproductive age, particularly the younger woman, we will discuss whether or not she have use of the COC or not, both condition. So women with the reproductive age who are not using COC, among the women reproductive age, though are using the combined hormonal contraception, contraceptive contraceptive in the 10,000 women in each year. So during the pregnancy, VTE risk is higher, like 29 per 10,000. This is a very important, even a question point of view. So the week immediate after the pregnancy, the greater risk will go to be like 300 to 400 per 10,000. And the women were reproductive who are having the combined hormonal contraception and the using of a combined hormonal contraception with a risk of the VT increase. And that are the comparing with the non-user of a hormonal contraception. So here they show the combined testosterone, just to estimate increasing the VTE like we discussed already 5 to 7 per event per 10,000 per year. This is a important to be know about the question point of view percentage. So constitutional, we have 3 to 5 event per 10,000 here attributed risk of the COCs, and that will be the progesterone, desogestrel, gestrodin, despironone, gestogen, and we have dinogestrogen that we combine like transdermal page. We have Avera, and the combined vaginal ring we have the Nevo ring that may be containing the slightly higher VTA risk, that will be 6 to 12% percentage per year. So recent study showed that the COC is containing like low waste risk, which medicine we can use is safely. This is ethinyl estradiol, but here the percentage is very important. 20 microgram may be associated with the lower VTE risk, though containing those dose of ethinyl estradiol 30 to 40. So here they're going to be the study compare and give us the lowest dose of ethinyl estradiol 20 milligram with a lower risk. So the risk the woman will die if the patient have the VT event with the combined hormonal contraception. So here risk only 1% women with the VT. If we look to be another the cause to be the patient will die, this is among to be 1 million reproductive age of the woman, though however 3 in the 10 women will be die among to be the reproductive age. So estimation the die each year result of the VT attributing and using of combined hormonal contraception to put perspective for over 1 million in the UK women reproductive age will die around 12 in the traffic accident, and the 55 will be unaccidental cases per year. So if we will compare this data, this is giving us clue to be only the 3 per 10. This is with the combined hormonal contraception user, the 12 with the accident, and unaccidental or any other causes will going to be 55. So this is the cohort study by the UK. The age less than 45 year were currently using of the contraception had been the last 5 years. The risk of the death, all of the case, there is no higher than the women who never taken oral contraception. So here the they explain and to be show us this the according the COCs is not going to be our combined hormonal contraception is not giving to be affect the patient to be the higher risk. So user of oral contraception along with the term the risk of the death for any cause, overall the reduction risk death for a woman ever reverse. Comparing those have a never other and they are the using the contraception. So here is going to be clinician tell the woman about the risk of the VT. So we have this is our job to be discussed with the patient and discuss the risk of the risk and usage of the combined hormonal contraception and with usage the risk of the VT. So discuss contraception choice. Women doctor nurses advise explain the risk of the VT associated with the combined hormonal contraception and inform the woman possible symptom like the faculty of sexual and reproductive health guidance, and the clinician advised women use of the hormonal contraception should be able to convey the risk of the VTA, providing information the overall risk and the benefit that help to be the woman will be judged the level of the risk and acceptability and them as a routine practice, and to be explained the woman that the risk of VT is going to be increased by combined hormonal contraception should be urgent the medical attention if the woman have experience of the pain, redness, swelling, headache and the chest pain, breathlessness, coughing up with a blood. Oh, this is the scenarios. If the patient will represent, they have to be reach the clinician as soon as possible. So it should be have the explain to women with the consider usage of the combined hormonal contraception that the method is going to be like. And the combined hormonal contraception going to be another effective method explain even such like intrauterine contraception, progesterone only contraception routine available that is not associated with increasing risk of the VT. So other procedure we have to be discussed with the patient. So we have why the woman choose the combined hormonal contraception, why this is the patient is thinking this is the very effective, why this is favorable, or why this is a taste as good. Here the 3 million women, over the 3 million, over the 3 million in the UK, they choose the use of a combined hormonal contraception among the 16 to 24-year-old in the UK. So combined hormonal contraception usage currently more than the 99% effective preventing pregnancy. This is the benefit, and they are the seeking only this. So women may be the choose of a combined hormonal contraception reason individual preference and because their experience and associated side effect with other the contraceptive method. For some reason, same reason, maybe the women who the optil of use of the combined pill and a particular progesterone page, vaginal rings, and sometimes women choosing the combined hormonal non-contraceptive benefit, including the management of heavy and the painful menstruation, especially the HMB. This is a very useful guideline of NICE. They discuss about the HMB management. So management of acne, additional the COC is associated with reducing the risk of the development and ovarian and the endometrial cancer in the later life. So benefit which persist for several decades after the stopping of a combined hormonal contraception. So here the evidence suggested that decreasing the risk of the colon cancer recent use of the COC. If the patient with the recent user of the COC here going to be risk of the colon cancer is going to be decreased. So we have CEU conclusion. We will consider that is a popular and effective. The VT associated use of the combined hormonal contraception are a rare event. So these already a rare event like minority, only 1% is going to be the fatal, and the risk of the VTE use of the combined hormonal contraception, the much more than the pregnancy and the immediate after the childbirth. So women reproductive age much more likely die accident and then the risk of the VTE event. Attributed even consider according to awareness, potential risk and the benefit. So here the FSRH, the guidance help us to clinician to avoid the use of the combined hormonal contraception in the woman with additional risk factor VTE and the combination that overall requesting contraception should be informed about alternative contraceptive methods and are not associated with the risk of the VTE. So begin information about the and accessing of a contraception method from our advice and our guidance. So here to be the patient should be given information about the like contraceptive method, another contraceptive method that is implant, nexoplan, and levogestrel releasing intrauterine system like Marina, Levos, and the Giades, and the copper IUCD, and offer to most effective contraception without any risk of the VTE. The women have been made aware potential risk associated with the combined hormonal contraception and the alternative, more effective method ready to available, and maybe the judge and the level of the risk acceptance and the fully informed decision for easy for a female to be take is the combined hormonal contraception. I hope you guys like my presentation today, my topic discussion. If you like, if you have